I just want to say welcome to Kicking Sciatica and Piriformis Syndrome Out of the Butt live online webinar. I'm so glad you're here, and seriously, I am so excited to present this information to you today. My goals for today's webinar are very simple. Number one, I want to explain why the treatments you have done thus far have not worked for you. I want to explain why it is not your fault. I want to tell you my 3-step common sense sciatica treatment formula that is actually sweeping the nation and really sweeping the world and literally changing hundreds of lives, and how by using the system, you will find relief without medications, injections, or surgery. And last but not least, I want to give you a sense of hope and excitement that you can finally break free from this misery. I am a get to the bottom line type of guy. Have you ever listened to a webinar where the person who was giving the webinar went on and on and on, thinking it was good salesmanship, waiting and waiting and making you wait till the very end for the goods while stringing you along the entire time? Well, that is not me, and that's not who I am. So let's get down to business right now, because I want to tell you my 3-step formula that's been helping thousands of people overcome sciatica and piriformis syndrome. After doing normal PT for the first 15 years of my career, I realized that many of us in the medical profession are very tunnel visioned and we make mistakes. And the results for you are bad advice and therefore bad results and people suffering longer than they need to be. So I would focus all my efforts on the affected side of the body, the painful part of the body only. I didn't take into account the entire rest of somebody's body that was compensating for the area of pain. I didn't consider the rest of the body at all and all its imbalances. And honestly, the diagnosis in the patients that I had trouble with when I owned my 3 clinics, that I had most trouble with were the sciatica and piriformis syndrome clients. I would help maybe 15 to 20% of them by doing what you see here on the screen that I'm sure is very familiar to most of you, along with doing some traction, doing some electrical stimulation, and a lot of manual therapy. And I was really frustrated and knocking my head against the wall in frustration for those 80 to 85% of sciatica sufferers who I just was not giving relief for, not getting them the help that they really, really deserved and that I wanted to give them. Until about 15, 16 years ago, I stumbled into an advanced continuing education course that honestly went 180 degrees against everything I had learned in physical therapy school and any other course that I had ever taken. This started me on my journey to develop the approach that I'm going to be teaching you today, and the approach and the protocol that I have had since that time. And in all honesty, it has helped me succeed with over 90% of my sciatica clients. So my way of kicking sciatica out of the butt, I use your own body to heal itself naturally, holistically, balancing out the body's imbalances first. I use active resting and release what is aggravated, irritated, and painful. So I actively rest and release those areas of your body. I work on what is comfortable to release tension in the body. All of this balances out imbalances in your body that are caused by all the compensations, and it puts the body in an optimal position to heal. And before I get into my 3 steps, I just want to talk about the typical journey of a normal, typical client of mine. Now, please note, there are many variations of this, but I tried to hit the typical points along the painful journey of a typical client. After they did their Google and YouTube searches, they would go to their doctor or PCP, their primary care physician. They'd get the x-rays, the anti-inflammatories, the pain medications, and the muscle relaxants, along with possibly an exercise handout, which was pretty generic and probably looked like those exercises that I showed a couple slides ago. Then if that didn't work, you'd go back to the doctor. They would change up the medications because obviously it's the medications problem, not a lack of knowing what to do for you, and possibly start PT at that time. And you may have started some massage or chiropractic at that time on your own. Then if all that did not work, it was time to get that MRI so that they can see what's going on. After the MRI, and they're not 100% sure what's going on, you might have gotten referred to an orthopedic or a neurosurgeon. And then the hunt and peck and what's going on, we have to figure out, is it coming from your back? Is it coming from your piriformis? Is it coming from your hip, your SI joint? Is it a muscle? Is it a nerve problem? Back and forth between specialists. A lot of my clients have gone. And then because the medications weren't working, obviously it was a medicine problem. So we changed the medications, possibly did some injections, and then we would go back for some more PT, which was almost pretty much more of the same. And you could throw in, like I said earlier, the chiropractic, the massage therapy, maybe some yoga and Pilates, some acupuncture, cupping, myofascial release, some Egoscue method, the miracle creams, the foam rollers, the TENS machines, and throw into that mix what a friend or family member said, what a coworker tells you worked for somebody in their past. You can add emergency room visits, pain management doctors, osteopaths, everything natural, inversion tables, decompression treatments, dry needling, everything under the sun. And guess what? I completely understand, because you were looking for help from anywhere you can find it. And guess what? It wasn't your fault that you weren't finding your help, because you were doing what you were told. You felt you were getting more than just a Band-Aid approach to your issue. And I am so sorry that you have been put through this mess, because 99% of all these people who have seen you previous in this route were all focused on the painful area of your body and did not look at or use the other 90% of your body that could be utilized for symptom relief. And we're going to get into that shortly. And some of you are scratching your heads going, what do you mean the other 90% of my body? How can I use that for symptom relief? All of these treatments can leave you feeling very similar to these people, feeling depressed, overwhelmed, confused, fed up, frustrated, worn out, angry, helpless, hopeless, discouraged, and lost. And I'm assuming many of you who are on this call are in this condition right now. And all of this leads to massive chaos for most people, because they're doing what they're told. They're taking their medications. They're doing the ice. They're doing the heat. They're stretching the crap out of their painful side, digging on their painful side, possibly getting some temporary relief, thinking, hey, if I keep doing this over and over and getting this temporary relief, maybe it'll last longer and longer. So, are you ready to learn my 3 simple step approach to recovery that is nearly guaranteed to end your pain, regardless of your specific diagnosis, regardless of what you've done till now or how long it has been going on? Well, here it is. Dean's 3 simple steps to kicking sciatica and piriformis syndrome out of your butt for good. Number 1, I want to balance out imbalances first, because your pain has not gone away because you have not balanced out your body's imbalances. Number 2, I want to restore normal, pain-free motion, because you need to be pain-free before you strengthen or stabilize your body into place. And number 3, I want you to return to activities wisely. You need to give your body a chance to readjust to normal before returning to all normal desired activities. And it's always good to remember that you are in a marathon, not a sprint. And you're looking at these 3 things, wondering how in the world can balancing out your body, restoring normal pain-free movement, and returning to activities wisely really work. It sounds kind of simple. And let me tell you, it actually is pretty simple. And I just want to introduce you to 3 people who started my 3-step program and show you their results. Number 1 is Tina White. I just highlighted stuff in her list there so you don't have to read the whole thing. She suffered with piriformis syndrome for 20 years. At the end, she writes, "Thank you, Dean, for giving me my life back, for giving me my passion, for giving me back my favorite thing to do, which was make and teach pottery." Then there was Christine, who was from New Jersey, got married and moved with her husband to Norway because he was Norwegian. And she said, "Hey, Dean, this is the first summer in 16 years that I have zero pain. I haven't had it since we last spoke, which was in September, or maybe it was November of 2020. And she still, to this day, has not been suffering. I keep in contact with her." And here's Carrie Johnson, who, if you look at the bottom, she just turned 50 a month ago. And she said, 2 years ago, this was unthinkable. She's jumping rope in a gym. When I met Dean on a video consult, I was almost crawling on all fours in excruciating pain, not sleeping, completely miserable. And I never felt so hopeless and depressed in my life. So let's get a little bit more in depth about what my 3-step program entails. So number one, I said we need to balance out the imbalances because your pain and problem persists because your body is still out of balance. Okay? So alignment and balance are critical. And when I'm talking alignment, I'm not talking about a spinal alignment. I'm not talking about you needing to get adjusted. But if your foundation or your starting point is off, you will continue to experience recurring pain and problems for years to come, which is devastating and sad. You need to fix what is uneven or out of balance first. So, just like the picture shows a poor foundation of this house, stress to the walls and the entire structure is not normal when the foundation is tipped like this compared to flat like it should be. This will cause stress to the walls, which the walls are not used to being in because of the angle. They're usually used to being, the walls are usually perpendicular straight up and down, but because now they're leaning, there's going to be eventually a buckle in the wall and giving way of that wall because of the extra forces. Our big problems in our body compared to this house is our bodies do not come with a body home warranty. So fixing your low back, butt, or hip without fixing the imbalances or the foundation first would be like putting an extra piece of drywall against the sagging or strained wall in this house, hoping that it would reinforce the wall enough so that it would never buckle or stress again. But you know the stress in the wall is going to be there, and putting a piece of drywall might temporarily make it look better and feel better because you're not seeing it buckle, but eventually it will buckle again. So Dean, how do we balance things out? Because we've never done it before. So initially, here's what I tell my clients. First, you need to stop stretching and irritating the painful side. When you balance out imbalances throughout your body, you put your body in an ideal position to heal. Then you can start focusing on what is hurting. And as I put at the bottom of the screen, oftentimes focusing on what's hurting is irrelevant because once your body is balanced, what is hurting typically calms down. I know this sounds crazy, but if you stretch or irritate what is already painful and irritated, the body will protect itself, which means the body will compensate for itself, causing imbalances right side versus left side of your body. This adds stress and strain to the body, which does keep it from healing. So think of it like this. If you already have a tight muscle, and as physical therapists, as chiropractors, as doctors, we're taught that when you come in with a very tight muscle, the best thing you can possibly do is take that muscle, stretch it further, meaning make it tighter to calm it down. Does that make sense? Pulling on something that's already irritated and tight, making it tighter. This does not work anywhere in life. Think about yourself in a kitchen. If you had a jar that's too tight to open, would you really take that jar and say, hey, if I just make you a little bit tighter, things will loosen up? Of course not, because life does not work like that. And when your body is tense and tight and irritated, I like to say it's sort of in a heightened state of alert, and it's much more sensitive to outside forces. I liken it to the car warning sensor light on your dashboard. If your light on your dashboard says, hey, oil pressure low, or hey, your gas is empty, do you just keep going and ignoring it, or do you actually address the problem and take care of the need? Now, a lot of people are saying, Dean, you don't understand, both sides of my body are painful. And that is very, very true. So that is understandable that you'd go, I don't have a good side. Well, for people like you, which are aplenty out there, what I do is I look for other parts of your body that are out of balance to balance those out first, so that I can calm symptoms down in your low back and your legs before we address those imbalances. So most people say, so what kind of exercises and stretches are you talking about? They are movements, exercises, and stretches that honestly I have fine-tuned and perfected over the last 15 years to balance out imbalances in your body, which will give you rapid pain relief. And the best part is they can all be done from the comfort of your own home. Now, these exercises are not Zumba-like activities or running on the beach or strenuous activities that people think of when you hear, oh no, I got to do exercises. But they are simple movements and motions that are exactly what your body needs to make progress in the shortest amount of time. Just wanted to share with you some more of my clients who have gone through my 3-step program. Donna Rada, I still find it absolutely unbelievable that I hardly hurt after only 3 days of your program. Susan D. Felice wrote, just had my 30-minute consultation with Dean and I couldn't stand up when we started. I was bent over. We did 2 exercises and now I can stand up. Not sure how long it will last, but I'll keep doing the exercises. Johnny Allen, which this to me is one of those things that just make me smile as a provider to help somebody like this. After 6 surgeries, tons of PT, and getting nowhere after my accident in 2014 and getting hooked on Percocet, in February, I believe it was 2019, that he found me. I found this group in Dean's Methods. At that point, I was still having severe sciatica pain and had piriformis and a torn hamstring from pushing myself too much to recover. And then yesterday, I mowed my yard. I haven't been able to mow since 2014. So 5 years, 6 surgeries, tons of PT. Today, I'm a little sore, but nothing like I thought. An even bigger personal milestone for me is that today marks 3 months of being off painkillers. Thank you, Dean, and everyone here who has encouraged me to keep trying instead of the other route I was headed. I'm a testament that his methods work. Give his stuff a legit try. You may be shocked. I am, and I'm glad I did it. Next was Joanne Nardo. This one made me laugh when I read it the morning she wrote it. Good morning. I'm so scared. I don't want to move. For the first time in 5 years, I woke up almost pain-free. And Pauline Richards said, I had a 30-minute consultation with Dean this evening, as well as excruciating pain in the buttocks and back of both legs. I had a fall 18 months ago and tore a ligament in my right shoulder, which prevents me from lifting my arm. Well, am I dreaming? Not only is the mobility and pain much improved already in my legs and butt, but I can also lift my arm right up as well. Wasn't expecting that. What happens when you balance out imbalances in your body is you're taking tension out of your body, which is keeping your body from functioning normally, and movement and pain follow. In other words, movement increases and pain decreases. So are you able to see why addressing the painful part of your body, like we are taught and like you have probably been shown to do, before getting the rest of your body in balance has been the reason for your continued issue? I'm so sorry that we were taught, and then we taught you that stretching or digging on the painful side would help you. You may get some temporary relief, which leads you to more and more hoping for longer relief, but typically it does not work. And it is not your fault. It is not your fault at all. And I want to emphasize that. And I apologize to you on behalf of all the therapists, chiropractors, and doctors who have been telling you to stretch your painful side. I want to share another quick story. This is my first online client. I did a webinar back in 2018. I had 25 people register. One person showed up, and it was Peggy Ann Clark. And I said, you know what, Peggy, I'm going to go through the webinar and then we're going to talk. So she wrote this 2 years later. She said, I just wanted to add that I have been totally pain-free for 2 years, thanks to Dean and his stretches. But last weekend, I did some work outside, up and down the ladder 20 times, made my sciatica flare up. So I spent the entire day in mild pain, limping, feeling like I started out 2 years ago, but I remembered the stretches Dean had taught me. And so I did them several times Sunday. Monday, I woke up with no pain again. So just remember, once Dean gives you the tools you need, never forget them and think that they will never work again if you ever find yourself back in some pain one day. These tools are your best friends forever. So listen to what Dean tells you, shows you, and talks about in his book. They're lifesavers. What will help you if you ever need them again. Thank you, Dean, from 2 years ago. And then I wanted to just share my first full-time client. Now, Peggy did not have my do-it-yourself online course because it wasn't available at that time. But Shonda here is my first client to ever go through my do-it-yourself course and be a full-time client of mine. After our initial consultation that she is speaking of and writes about here, honestly, I was very skeptical. I can tell you, Dean helped me more in less than 2 minutes than 4 months of chiropractic, 2 doctors, and 2.5 weeks of therapy. Now, let me clarify that. We did the exercises in 2 minutes during her call, and it was those 2 minutes that made more of a difference than the talking that we did before or after that. So I don't want anybody to think that, hey, you talked to me for 2 minutes and I'm better than 4 months of chiropractic and 2.5 weeks of therapy and 2 doctors. She didn't believe it could be that easy, but I was wrong. And she was excited to see where she might be 2 weeks from now. And 2 weeks from now, 2 weeks from then, she was 80% to 90% better. And she's been living pain-free ever since. So let's go over my 3-step program more in depth now. So step 1, I said, is balancing out imbalances in the body, correct? Step 2 is restoring normal pain-free movements. You need to be pain-free before stabilizing your body into place. Now, I don't expect any of you, because I can't do those first 2 movements, but it's just to show that we got to be getting you moving. But if you came to visit me in Santa Monica here, we would definitely get out on the beach and do that 3rd picture and just thank God that you are in better shape than when we first met. So a huge mistake often that is made is this. We attempt to improve our core strength or increase the strength of our weak muscles while the body is still in pain and still compensating, or as I like to say, out of balance. If there is pain, the body is compensating for that pain. That's just a fact. There's no way to accurately assess muscle strength when your body is out of balance and stressed. Your muscles are not functioning normally. So to try to strengthen something that you don't even know is weak because you can't test it accurately because your body is compensating doesn't give you an accurate reading of where you're at. Plus, I always tell people, if you're in a painful position, why do you want to stabilize and strengthen your body into that position anyway? I do not allow my clients to start stabilizing their core or weak muscles until they're balanced, have pain-free motion, and they have minimal to no pain remaining. Even then, I start slowly and I try to avoid stressing the affected body part. So to repeat, step 1, we need to balance out imbalances. Number 2, we need to restore pain-free motion and mobility. Number 3, we need to return to activities wisely. We need to give our body a chance to readjust to normal before returning to all desired activities. And these are some of the desired activities that a lot of my clients talk about. Hey, getting to the beach or going on vacation with the family, doing some gardening, getting back to the gym and exercising, just going for a walk with a friend, and obviously get out shopping and not have to worry about lifting a bag, not have to worry about spending 3 days in bed after you've been out shopping and enjoying yourself. So this is Dean's tried and tested ladder of success. Number one, we've got to restore balance. Number two, we've got to restore mobility. Number three, we have to improve stability. Number four, we've got to return to activity wisely. And last but not least, we always have to fine tune episodically, simply because what happens is when people start feeling better, they typically want to get back into their activities very quickly, and flare-ups can occur. So that's why I said you want to return to activities wisely, slowly, and steadily. But if things do flare up, we might need a fine-tuning episodically, but that is basically just getting back to the basics and balancing out your body. The overall point is this transformation process is one that I understand intimately. And once you understand it too, you will be able to apply the same process to achieve the pain-free life you want, need, and deserve. I've seen it all and have dedicated my life to making sure you no longer have to suffer. This is my passion, or as my wife says, it's becoming your obsession. So, because I'm a bottom line type of guy, I want to tell you what I have for you available if you want to learn these principles and these things. Here's what I have for you. I have a do-it-yourself online program appropriately called Kicking Sciatica's Butt. It was created 4 years ago, but literally just last month, March of 2022, I updated and upgraded every single video. I updated all the information and added new information that I've learned over these past 4 years since I originally created this program. So it's an all new and improved version of the course that helped all the people you learned about earlier. So I have some questions for you to ask yourself. What am I missing out on by not getting this fixed once and for all? What toll is this taking on me relationally, mentally, emotionally, and financially? What would being pain-free mean to me? What do I want my life to look like in a year? Am I happy with my current progress? This picture was used as I had one client ask me if she would ever be able to get back to weighted hula hooping again. And the big question to ask is, do I want to keep doing the same thing over and over again, hoping one day that I will get better results? So being the bottom line type of guy, here's what I have. If you're serious about winning this battle, here's what I have for you. My do-it-yourself online course, Kicking Sciatica's Butt, which includes the following: a step-by-step course to guide you to overcoming sciatica, all the exercises needed with variations to each as needed to win the battle against sciatica, tips for pain-free walking, tips on how to prevent reoccurrence, body mechanic tips and relaxation tips that you use while healing and beyond, body stabilization and strengthening exercises to hold your gains once balanced, frequently asked questions section with video answers to all the common concerns. The entire program is released all at once for you to learn, practice, and progress and move through at your own pace. Access to a private Facebook group made up of other online course participants. A lifetime access to the complete course, along with updates included, just like I did last month. I can't tell you when the next updates will be, but every once in a while I add a new video and updated information for you, and it's yours for life. Number 11, most people notice significant improvement within 10 days. And by taking my do-it-yourself online course, Kicking Sciatica's Butt, you will be empowered to take back control of your life again. Feel like you have your own personal coach, learn how to overcome your pain, learn simple activities to minimize your symptoms, be guided through simple exercises that will help calm your symptoms. You will start to have hope about overcoming the agony of sciatica. You'll be amazed how simple activities done right can make huge difference. You will have fewer visits to the doctor's office. You'll begin enjoying the simple things in life again, and you will return to living your life without fear. Now, these are not 10 things that I made up and statements that I thought would sound good. These are actual things that multiple clients have told me about my course in the past. So if you're serious about your health and you're willing to invest to win the battle, simply copy down this information. Actually, what I'm going to do right now is I'm going to put this in the chat so you can copy and paste it. The web address is go.sciaticareliefnow.net/course. And if you are serious and you want it, I'm offering a 30% discount to the course. And I got to tell you, I know so many people who are paying anywhere from $200 to $500 a month for things that have not worked for them. And this is less than $500 once you include the 30% discount. So if you want this course, look it up. And if you're not handy with a computer, please know that you're going to be getting an email with this link and the code for the 30% off. The coupon code is webinar. You type in webinar where it says coupon code and you will get 30% off. If that is something you need, please feel free to stop this webinar right now and go take care of it. But please know you'll be getting an email with all this. If you want to learn more about me and a little bit more about the program and some things that are frustrating me with the medical field and why it is that what you've been doing has merely been a temporary Band-Aid approach fix, please continue to watch. I've got a few slides left, but I should have done this at the beginning, but I'm doing it now and I'm introducing myself. Who am I? My name is Dean Volk. I am currently an online consultant. I've been a physical therapist for over 30 years. I'm a husband and father of 2 amazing young men. I'm an international sciatica relief expert. I am founder of Sciatica Relief Now. I literally wrote the book on sciatica relief. It is called Sciatica Relief Now. And according to my mom, I am the best physical therapist in the world. Now, here is my why in life. She's right there. Her name is Trudy. And here are my other 2 whys, Ben and Jesse. This is us. I started working in orthopedics and sports medicine clinics since I graduated PT school in 1992. From 93 to 2006, I was a clinical director both in Phoenix, Arizona, and then I moved to Charlotte, Arizona, where I opened my 3 clinics, actually one at a time, back in 2006 and sold them in 2020. From 2017 to 2021, I owned a mobile concierge practice where I went to people's homes in Charleston, South Carolina, and was charging more than $200 a visit to come visit people for 45 minutes and to help take care of their symptoms and problems. In May of 2018, I founded Sciatica Relief Now, which is an online sciatica and piriformis syndrome relief service. And in May 2021, I moved across the country to Santa Monica. So one massive issue that I have with many medical providers is this. We tend to build dependence on us and our skills instead of empowering you to take control of your life. As health professionals, we go into this profession to actually help people. So we don't intend to make you dependent on us, but that seems to be what happens. We go through years of schooling and scientific study to learn all about the human body to help you. But being in healthcare for over 30 years, I've realized something, and that is we tend to create dependence on us. And I would rather empower you for you to take control of your healing and provide you with a plan and a process. Give you your own go-to exercises that you can have forever to help you control your pain. And here's what I mean by problems in medicine. So you go to a doctor and the doctor says, you have a disease caused by your diet. Oh, so the patient says, so should I change my diet? No, not at all. We have a pill to fix that. My goal for you and for working with every client is this. I want to create independence for you from needing me or anyone else to control your pain and symptoms. I want to empower you to be in the driver's seat after you gain the understanding of my 3-step, simple, common sense approach to healing. Most of my clients have tried numerous things before seeing me, from medications, injections, physical therapy, chiropractic, Pilates, yoga, acupuncture, all the YouTube exercises, massage therapy, TENS machines, just hoped it would get better on its own, using tennis balls, foam rollers, inversion tables, and many even having surgery. And here is why they didn't work, and here's why it's not your fault. They are mostly temporary, Band-Aid, and sometimes potentially even harmful approaches because they ignore the rest of your body and they focus on the painful area only. So some of the temporary and Band-Aid fixes are pain relief creams, hot pack ultrasounds, TENS, injections, pain medications, anti-inflammatories, muscle relaxants, manipulations, massages, stretching the painful side, all attention to the painful side. And even though you can get some temporary relief, just like I did for several of my clients before I learned these treatment approaches, some people actually respond to that, which I'm still scratching my head at, but I'm thankful that I was able to help 15 to 20% of my clients previously. But again, my simple 3-step approach for kicking sciatica and piriformis syndrome pain out of your butt for good is: number 1, balance out those imbalances first, because your pain has not gone away because you have not balanced out your body. Step number 2, restore normal pain-free motion. You need to be pain-free before strengthening or stabilizing your body into place. And step 3, return to normal activities wisely. You have to give your body a chance to readjust to normal before returning to all normal activities that you desire to do. And it's always good to remember you're in a marathon, not a sprint. I've had the privilege of using my programs with clients who were thinking it was too good to be true or were very skeptical. Brenda over here said, quite frankly, I thought he was a quack just taking people's money, but I was desperate. And she was at least 50% better soon after starting. Jennifer said, I'm not going to lie, I was skeptical that Dean Volk could help me remotely with my sciatica. I also know it was the best decision she ever made, according to her. Dana Simon said, I'm generally a skeptical person, but I'm so thankful for you for giving me hope, Dean. I've also worked with people who had tried everything. Anna said, been a month exactly, and it's been the worst I've ever been. I've seen a chiropractor, a PT, a massage therapist. I've had dry needling, heat, cold, TENS, muscle relaxants, and pain meds. Bottom line, if you're skeptical, you have nothing to lose but your pain. I was skeptical too, and now I'm 100% believer. Do yourself a favor and reach out to Dean. Johnny Allen, he was the one who had the 6 surgeries. For me, I found this group after 4 years of nonstop back pain, 4 surgeries at that time, 4 back surgeries, 2 hip surgeries. So 6 surgery, was literally wanting to kill himself. He became an addict, but I will 100% back his routines because he's back to living a happy life. Tina said, I can honestly say that after 3 years of pain, I no longer have pain on my side after countless doctor's appointments, physical therapy, therapeutic massage, chiropractic physics, acupuncture, steroid, spinal injections. None of that helped relieve the pain. I also worked with people who would just thought they would get better on their own or wanted to figure out themselves. Margaret said, so I've been a member of the group for a long time. I'm also really stubborn and independent, thought I could figure this out. Seriously, I'm so much better than what I have been in ages, and even better, I know why after working with me. Zach had been going on this journey for the last year. He'd had low back pain and it would be worse. He was a bricklayer, if I remember correctly. He woke up with bad sciatica pain. He could barely walk, but he started working with me and he was 70% better in a very short period of time. I've also worked with people who are depressed, anxious, and fearful, like Carrie Johnson, who was at the lowest point of her life. She was the one who ran that half marathon. Darlene Wilson, who is a BMX biker, she was depressed. It was the most depressing time of her life. And now she is living again and BMXing even while pregnant and just having a baby and back to BMXing again. So basically, I tell people I'm the place where people come when they're tired of trying the Band-Aid approaches and are ready to feel and experience sustained pain relief for real. Let me tell you a little bit about Marcia. What a difference a year makes. Exactly a year ago this week, I had piriformis syndrome and sciatica pain at an 8 to 10 every day for the previous 6 months, plus lower back pain for 5 years. I was barely mobile, discouraged, basically non-functional. My life was on hold. Sitting and driving were the worst. My doctor sent me for an MRI, to a neurologist for nerve testing, then to a neurosurgeon who encouraged me to try every other treatment before surgery. I had 3 injections, an RF ablation, went to chiropractic for 7 months, PT for 2 months. I was helped some. Pain went down to about a 6. Then I heard an interview with Dean on a podcast, was intrigued by his unique approach, found him on Facebook, did my 30-minute video consult with him, signed up for his course. I'm on week 20 now, and my pain is at a 0 to 1. I'm so looking forward to being pain-free. Thank you, Dean, for the course, the emails, the messages, the videos, the webinars, the encouragement. And here's what some other past clients had to say. Here is Sean Falco Balance. She consulted with me on May 12th, started my program on May 17th. Her goal was to be able to get on the floor with her grandbaby. And here it is, a picture of them, which was 3 to 4 weeks after starting my course. Sin Baker said, you all need to try Dean's little intro session. I'm piriformis syndrome. I had piriformis syndrome person with a fused spine, a replaced hip who had a release that was the wrong kind. And I even get relief from exercises he has put together. Even I get extra relief from it. And Leslie Ann Beecher said, thank you so much. I took my dogs on a 20-minute walk with my husband last night for the first time in over a year. So are you ready to start your road to recovery now? Are you ready to finally do it the right way? Isn't it time to get it done correctly, be coached and directed by someone that's already done it successfully over and over and who's perfected this new treatment approach over the last 15 years? Can you imagine what it would be like not to have to miss another girls' night out, miss out on getting on the floor with your kids or grandkids, or simply go for a walk with your family? Do you remember what it was like to do what you wanted without the fear of paying for it later in terms of back, butt, and leg pain? Your time is now, so let's get you scheduled ASAP to start your road to recovery. It is time for you to start your transformation. So I just want to review what we covered today. Step 1, balancing out imbalances first. Your pain hasn't gone away because you have not balanced out your body. Number 2, restoring normal pain-free movement. You need to be pain-free before stabilizing your body. Step number 3, you need to return to activities wisely. Give your body a chance to adjust to normal before returning to all desired activities. So if you're serious about your health and you're willing to invest to win this battle, simply type in the web address, which is also in the chat, which you're also getting an email from me. And please do not forget to use code webinar at checkout for your 30% discount. So guys, thank you very much for joining me today.